Hi, John, is it?
Yeah.
Hi, my name's Dr. Barnes. I'm one of the doctors on the ward. I understand you wanted to have a chat today about your mother's case?
Yeah.
Okay, so I've had a chat with her and she said that's absolutely fine that we discuss her case. Can I just check, what do you understand about what's going on with her at the moment?
Well, I hear that her lung cancer is terminal now and it is spreading to her brain. And she's becoming less herself, getting a bit more tired and more bedridden.
So when did you last see her?
It's today.
Okay. And how did she seem to you at the time? You said she was a bit less herself. Anything else she was complaining about?
Well, she wasn't really saying much. She did mention that she was in a bit of pain and she had some headaches, but apart from that, she wasn't really saying much.
Yeah. I mean, obviously, I appreciate this is a really difficult time, and you know, she has got this terminal cancer now, as you say, and she has been getting worse. That's something that we've noticed on the ward, myself and the nurses and the other doctors. Certainly, she has been a bit more drowsy, and the pain. We've noticed that the pain does seem to be becoming a real issue. Is that something that you felt as well?
Yeah, because she had been mentioning it for a while, and I think she does want more of the morphine to take the edge off a bit, but I'm just worried myself that it's going to stop her from being herself.
So what we're doing at the moment, just to sort of clarify everything we're doing, you know, we are giving her a lot of tablets to take the edge off the pain, and we're giving her this liquid morphine that you've described. I think though it probably isn't really cutting it, and we do need to give her something stronger. What we would normally do in this situation is, in conjunction with the palliative care specialists, who are the people that manage these symptoms at the end of life, is we would normally offer to start a morphine drip. So that goes directly, you know, into the body, either into the vein or normally under the skin, actually. And that can be much more effective in terms of taking the pain away. Is that something that has been discussed with you before, or you've thought about?
No, it hasn't been discussed that much. Like, how's that going to affect her?
So what we would hope is that this is a stronger version of what she's already having. So we would hope that the objective is that she will have much less pain and she'll be much more comfortable.
But will she be more tired and more drowsy?
It's difficult to say. I think inevitably with her condition, she is likely to continue to deteriorate as she approaches the end of life, and she's likely to become more tired and probably more drowsy whatever we do. Morphine is a drug that can make you feel a little bit drowsy though, and a little bit confused sometimes. So it is common for patients when we start a morphine drip for them to become a little bit more confused and a little bit more drowsy, which I appreciate is something that you're concerned about. However, what we would suggest doing, what we would normally do, is start it at a very low dose, see how it goes, with a view to slowly building up the dose to give enough to control the pain, whilst hopefully minimising those symptoms. What do you think about that?
Well, when will we be starting that?
Ideally, we'd like to start it as soon as possible, I think, because she is in a lot of pain, and certainly she's been complaining about it to you as well as us, it sounds like. So yeah, I mean, if it's something that we're all in agreement about, it's something we probably aim to start today.
Will it affect her straight away?
So morphine works pretty quickly, so we would hope it starts to get on top of the pain pretty soon, yeah.
Because my brother's coming in soon and I want him to see her like one last time while she's still in a good state of mind, and I don't want him to see her when she's a bit tired and not being able to communicate.
Okay. When is your brother coming?
2 days.
Okay. I appreciate this is obviously really difficult. I think what we have to do is make sure that we keep your mother's care, her comfort and her well-being, you know, at the centre of everything we're doing. She is in a lot of pain and she is in discomfort.
Yeah.
I think you agree, and I therefore think that we should be looking to start this medicine as soon as possible. However, I totally understand that there are side effects with morphine. You know, it can make you more drowsy. It can make you less yourself, more tired as well. sometimes it can even make you feel a bit sick. So we want to try and minimise those side effects. And certainly it sounds like you don't want your brother to have to see her, or you want your brother to see her in the best possible condition that she could be. What I would suggest, thinking about doing exactly what's best for her, is we could try starting the morphine at a very low dose, see how it goes. If it works well and she doesn't have too many side effects, then we can continue it, possibly increase the dose to get on top of her pain. Your brother can see her, and that should be fine. However, if she were to react not so well to it, if she were to have more side effects and or perhaps it be a bit less effective for the pain, we could look at reducing the dose, or even withholding, or even stopping it and going back onto the tablet she's on now, with a view to keeping her, avoiding the drowsiness and stuff. Certainly, it's something that I think it would be worth us discussing with her, maybe together with possibly one of the palliative care specialists, and making a plan like that. Sort of start low, go slow, keep an eye on the effectiveness of the drug and the side effects, with a view to keeping her as comfortable as possible, but also trying to minimise, let's say, the side effects which you've correctly identified, because it can make you more drowsy and more tired and stuff.
How can those side effects be avoided?
So it's as I say, it's very difficult to know, and I think as patients with conditions like your mother's enter their, enter the end of life phase, people do tend to become a bit more confused anyway, a bit more drowsy, sometimes feeling a bit sick, a bit more sick anyway. There are things we can give, so we can give anti-sickness medicines, for example, to avoid the sickness. And we can give painkillers for the pain. What we would like to do is use those medicines as well as other things, keeping the room, making the room her own, giving her a side room for privacy, so you can enjoy good quality time with her. We'd like to do those things to make those last days as comfortable as possible. However, there is no way, unfortunately, that we can completely remove all symptoms. And certainly with the morphine, there is no way that we can avoid all side effects. But by, as I say, starting with a small dose and going slowly, monitoring her very closely, we can look to hopefully achieve a balance where we control her symptoms, her pain, well, but also avoid her having too much of the drowsiness, the confusion that we've talked about. That said, those symptoms are something that's common toward the end of life anyway, and it's very difficult to pick apart, what's going to happen anyway and what's being caused by the drug. But we can certainly do our best to keep a close eye on her, and try and minimise the side effects of the drug and the side effects of the of the dying process.
And is the morphine drip the only option?
There are lots of options. So I think for the pain, there are simple medicines like paracetamol, things like that, which she's already on, and they're drugs with relatively low side effects. The more potent drugs, though, are morphine or morphine based, and they all have a similar sort of side effect profile. But again, certainly in some instances, if morphine is really not tolerated by a patient, we could try out other versions. And again, that's something that we can work together with yourself, your brother, your mother, to see what works best for her, as well as the specialist palliative care teams. How does that sort of sound?
Yeah, I think it's the best way to go. Maybe to trial it and see what happens.
Yeah, okay. So to just summarise what we've talked about, your mother is entering, her end of life. She's being troubled by various symptoms at the moment, and pain really does seem to be quite a big issue for her. So we're going to try stronger medicine. However, as you've identified, there are side effects. So we'll keep a very close eye on her. We'll go up very slowly, and if she's suffering too much from the side effects, then we can take it back, or we can even try something different. Okay. Is there anything else you wanted to know from today?
No, I think that's everything.
Okay, well, thank you very much for today. If there is anything else you'd like to know, please ask me. And like I said, we'll keep you informed and maybe have another sit down and review how things are getting on in a few days' time.